Today, we're delving deeper into high cholesterol, a critical issue that affects millions of individuals globally. Did you know that having high cholesterol, which frequently has no symptoms, can be a silent killer? Because of this, we're here to explain the 6 warning symptoms you may be experiencing so you can take appropriate action before it's too late. But before we do anything, let's quickly review what cholesterol is and how it affects our health. Understanding what cholesterol is and its significance in our bodies is essential before we get into the 6 signs of elevated cholesterol. A waxy substance called cholesterol is produced by our liver and can be also found in some meals. Our body uses it to produce hormones and support digestion, among other vital processes. However, when cholesterol levels are out of balance, there might be major health consequences. A lipid profile blood test is typically necessary to properly diagnose elevated cholesterol. This examination evaluates the various forms of cholesterol in your blood, assisting in determining whether you have high cholesterol and should take precautions to safeguard your health. High cholesterol is a cunning enemy that frequently acts silently, making it all the more hazardous. It silently builds up in our arteries, gradually producing plaque that constricts the blood vessels and narrows the airways. Atherosclerosis is the term for the process that greatly increases the risk of heart disease, strokes, and other potentially fatal illnesses. What's concerning is that excessive cholesterol frequently goes unnoticed until it's too late, resulting in permanent harm. But don't worry though, we're here to arm you with the knowledge necessary to see the warning signs. We'll look at 6 signs that indicate elevated cholesterol in the portions that follow. You can protect your health from this sneaky enemy by becoming familiar with these symptoms and taking prompt action. Chest pain and discomfort are some of the most concerning signs and symptoms of high cholesterol. While there are many reasons why someone could experience chest pain, it's important to consider the possibility that elevated cholesterol may be a contributing factor. The form of chest discomfort linked to high cholesterol is sometimes referred to as angina, which is characterized by a feeling of pressure, tightness, or squeezing in the chest. This happens when the arteries supplying the heart with blood that is oxygen-rich narrow as a result of cholesterol buildup. It's important to get medical help right away if you have chest pain or discomfort, especially when exercising or under stressful circumstances. This symptom may suggest a higher risk of heart attack or other cardiovascular issues, so ignoring it or underestimating it could have serious repercussions. Keep in mind that it's best to visit a healthcare provider if you have chest pain in order to identify the underlying reason and receive the proper therapy. High cholesterol may be an unexpected factor to take into account if you've been dealing with persistent digestive problems like bloating, gas, or abdominal discomfort. Surprisingly, a lot of individuals don't know that cholesterol and digestive issues are related. Gallstones are hardened deposits that grow in the gallbladder and can develop when cholesterol levels are high. These gallstones can block bile ducts and interfere with a normal digestive process, resulting in symptoms like bloating, gas, and stomach pain. High cholesterol can also exacerbate fatty liver disease, which has an additional negative effect on digestion and general gastrointestinal health. Since early management can stop the course of these conditions and lower the risk of complications, it is critical to recognize the connection between high cholesterol and digestive problems. For a complete evaluation, diagnosis, and advice on controlling your cholesterol levels and enhancing your digestive health, speak with a healthcare professional if you've been having regular digestive issues. Cholesterol is quite a condition that we witness even in the youth nowadays, and the next point included in the list is a common symptom of having high cholesterol. You could be astonished by the insightful hints that your skin might offer regarding your cholesterol levels. Your eyelids, knuckles, or other areas of your body may develop yellowish deposits called xanthomas, which is a telltale symptom of elevated cholesterol. These deposits develop as a result of excessive cholesterol building up in the skin cells, and they show up as elevated yellowish bumps or plaques. It is essential to comprehend the underlying science of these deposits. LDL, one type of cholesterol-rich lipoprotein that can infiltrate and accumulate in skin tissues, is the cause of xanthomas. These buildups may indicate an unbalanced cholesterol level under the surface and a higher risk of cardiovascular illnesses. It's crucial to pay attention to these indicators, therefore. You may help prevent more issues and safeguard your cardiovascular health by taking immediate action to address them, including getting medical attention and treating the underlying causes of high cholesterol. Therefore, act immediately to preserve your general well-being if you discover these yellowish deposits on your skin. It's important to remember that a busy or frantic lifestyle may not be the only cause of your ongoing tiredness or weakness even after receiving enough rest. High cholesterol levels have been linked to weakness and exhaustion. The condition known as atherosclerosis, in which plaque accumulates in the arteries and inhibits blood flow, can be brought on by elevated cholesterol levels. As a result, the body's tissues and organs receive less oxygen and nutrients, making you feel weak and exhausted. Unfortunately, people frequently ignore or blame other factors for the connection between high cholesterol and weariness. However, controlling cholesterol levels can help regain vigor and energy. A healthy lifestyle that includes routine exercise, a balanced diet low in saturated and trans fats, and taking medicine as directed can significantly improve health. A healthcare provider should be consulted so they can examine your cholesterol levels, determine whether they're a factor in your weariness, and advise you on the best course of action. Remember, if you experience weakness and weariness frequently, don't disregard it. To reclaim your energy and enhance your general well-being, it's crucial to understand the probable connection between high cholesterol and weariness. Anything that happens to our body has its direct or indirect effect on our brain. And memory loss is most of the common symptoms in any condition, especially when it comes to cholesterol. So here we jump on to our next symptom. It might surprise you to learn that excessive cholesterol can have negative effects on not only your heart health, but also your brain. It's critical to think about the likelihood that high cholesterol may be a contributing factor if you've been experiencing cognitive defects, memory issues, or trouble concentrating. The structure and operation of brain cells are highly dependent on cholesterol. The creation of plaques in the brain's blood arteries, which reduce blood flow and impair cognitive function, can occur when cholesterol levels fall out of equilibrium. A higher risk of diseases like dementia, Alzheimer's disease, and cognitive decline are linked to high cholesterol. To safeguard your cognitive talents, it's crucial to comprehend the connection between cholesterol and brain function. Managing cholesterol levels through lifestyle changes, such as switching to a heart-healthy diet, exercising frequently, and giving up smoking can help reduce the risk. The management of cholesterol levels may also benefit from prescription drugs issued by medical professionals. In addition to protecting your heart, lowering your cholesterol also protects the health of your brain. Don't discount the possibility that excessive cholesterol is playing a part in your cognitive decline or memory issues. Take preventative measures to control your cholesterol and safeguard your cognitive function for a healthier, sharper mind. And even though this symptom mostly affects men, it's critical that everyone understands its importance. High cholesterol may be related to erectile dysfunction, a frequent problem experienced by many men. It's critical for men and their spouses to comprehend the link between high cholesterol and ED. It's important to keep in mind that the relevance of excessive cholesterol and its connection to erectile dysfunction goes beyond only sexual health. It is a sign to place an emphasis on overall well-being.